بسم الله الرحمن الرحيم. السلام عليكم جميعا ورحمة الله وبركاته. Today we will speak about insulin and anti-diabetic drugs. As you see in this figure, there is islets of Langerhans in the pancreas contain alpha cells and beta cells. Beta cells releases insulin and alpha cells releases glucagon. Insulin released when there is high blood glucose level. Then insulin will reduce the glucose level by increased glycogen synthesis in the muscle and suppress glycogenolysis in the liver, and in the all tissues transport glucose and amino acids into the cells. Also in the kidney, insulin will increase absorption of glucose from filtrate. But if there is low glucose level, there is hypoglycemia, glucagon will be released, and glucagon will act opposite to the insulin. Glycogen induce glycogenolysis and release of glucose into the blood. Here we can see in homeostasis normal blood glucose level about 90 per 100 milligram per 100 milliliter. If there is high blood glucose level, this will stimulate insulin. And if there is low glucose level, this will stimulate glucagon, which is released from alpha cells, and insulin released from beta cells. We can see in normal glucose control, post-absorptive period, in normal individual, basal level of circulating insulin دائما يصير maintained by beta cell secretion. Suppression هذا الانسولين راح يسوي suppression of lipolysis, proteolysis and glycogenolysis. لكن بعد ingesting a meal, after ingesting a meal, burst of insulin secretion in response to elevated glucose and amino acid levels. When glucose level return to basal level, بعدين insulin secretion راح يصير return to its basal level. فشفنا انه لما يزيد after meal يزيد الانسولين secretion. Now, what we mean by diabetes mellitus? Diabetes is a heterogeneous group of syndromes characterized by an elevation of glucose level. ليش يرتفع الجلوكوز level? Due to a relative or absolute deficiency of insulin. إذا عندنا diabetes mellitus هي due to deficiency of insulin, and it is characterized by high level of glucose in urine and fasting blood. Also there is polyuria, polydipsia, fatigue, and constant hunger. There are two types of diabetes mellitus. Type 1, which is called childhood diabetes. It is a sudden onset. It is before age 15, أو نسميه juvenile diabetes. There is a lack of functional pancreatic beta cells, and lack of functional beta cell prevent mitigation of elevated glucose level and associated with insulin responses. This is controlled by insulin injection. Type 1 controlled by insulin injections. Type 2 diabetes, this is called adult diabetes. This is appears after age of 40, especially in obese individuals. Insulin levels are normal or elevated, but there is either a decrease in number of insulin receptors or the cells cannot take it up. فإذا أن الانسولين receptor number راح يقل. Actual insulin level may be normal or supranormal, but it is ineffective. يعني المشكلة هي إنه أكو insulin resistance. فأني controlled by dietary changes and regular exercise. Now we have to see drugs used in the treatment of diabetes. They are either insulin, which, as we said, insulin aspart, insulin detamer, insulin glargine, insulin glulicine, insulin lispro, MPH insulin suspension, and regular insulin. بالنسبة للإنسولين أكو عندنا أمايلين أنالوج اللي هو براميلينتايد، وعندنا الأورال ايجنتس، أورال هايبوغلايسيميك ايجنتس راح ناخذها بالمحاضرات الجاية لايك كاربوس، ألوغلايلبتين، بروموكريبتين، كان glyphosine and other drugs we can see, and metformin, maglitol. These are very important oral hypoglycemia. If we speak about the treatment of type 1 and type 2 diabetes, we can see that insulin, the type 1 diabetes mellitus depends on insulin therapy. This is an experiment to see the release of insulin that occurs in response to an IV glucose load. We give at time 0, we give infusion of glucose, and they measure the plasma concentration of insulin. In type 1 diabetes, there is no insulin. In type 2 diabetes, there is insulin, but it is, as we said, there is insulin resistance. In normal subjects, there is high level of insulin secretion. So, the type 1 diabetes mellitus depends on insulin therapy, while type 2 diabetes mellitus depends on many things like weight reduction, exercise, and dietary modification. This will decrease insulin resistance, and addition of hypoglycemic agents. It is very important, and sometimes insulin therapy is also required. Now, insulin, it's a peptide hormone synthesized in the beta cells of islets of Langerhans in the pancreas, produced as a polypeptide proinsulin precursor. This is a precursor of insulin, اللي هو proinsulin. Proinsulin converted to insulin and C-peptide, insulin and C-peptide, and stored in the secretory granules. Then stimulation leads to the release of secretory granules. What is the mechanism of action of insulin? Secretion elicited by elevated glucose level. مثل ما قلنا إنه الإنسولين secretion elicited by elevated glucose level. Increased glucose level in beta cells results in increased ATP level. This results in a block of potassium channel causing membrane depolarization, which opens calcium channels. Then the influx of calcium results in pulsatile secretion of insulin. Then many insulin-stimulated cascades are activated, mainly translocation of GLUT4 glucose transporters. There are glucose transporters which are called GLUT4. They are translocate to plasma membrane, causing glucose diffusion into cells. راح تسبب دخول الجلوكوز into cells, activates glycogen synthesis, and thus glucose stored as glycogen, وأيضا stimulate uptake of amino acids, potassium and magnesium, وstimulate protein synthesis and inhibit proteolysis. فإذا هاي GLUT4 glucose transporter is very important for the action of insulin. 1 unit of insulin can account for 30 grams of carbohydrate, and 1 unit can lower 50 grams per deciliter blood glucose. Here are the actions of insulin on various tissues. On the liver, decrease glucose production from the liver and increase glycolysis, increase triglyceride synthesis, and increase protein synthesis. In the muscle, increase glucose transport, increase glycolysis, increase glycogen deposition, and increase protein synthesis. In adipose tissue, increase glucose transport where lipogenesis and lipoprotein lipase activity and decrease intracellular lipolysis. The synthesis and release of insulin is modulated by glucose, most important, and ketone bodies. Glucose or ketone bodies stimulate release of insulin. Glucagon and somatostatin inhibit release of insulin. وعندنا alpha adrenergic stimulation inhibits the release of insulin, while beta adrenergic stimulation promotes the release of insulin, and elevated intracellular calcium promotes release of insulin. Pharmacokinetic principles of insulin. It is elimination half-life of IV insulin. It is 5 to 10 minutes. Metabolized by kidneys and liver. Metabolism of insulin, it is in the kidneys and liver. Insulin tightly binds to tissue receptors. So even though rapid clearance, pharmacologic effects remain till 30 to 60 minutes. Insulin secreted into portal veins, venous system at rate of 1 unit per hour. إذن عندنا secretion of insulin 1 unit per hour into portal venous system بالliver يعني. Daily secretion of insulin is 40 units. Insulin response to glucose is greater for oral ingestion than for IV infusion. Here we have insulin preparations and their onset, peak, and duration of action. We have rapid acting, or we call it regular or crystallizing. It takes 0.5 to 1 hour to be acting. Will take peak level multi 2 to 3 hours, with duration 6 to 8 hours. We have very rapid acting اللي نسميه ليسبرو or اسبارت. هذا ياخذ له ربع ساعة إلى نص ساعة يشتغل. والبيك ليفل مالته 0.5 to 1.5 hours, with duration 4 to 6 hours. وعندنا الانترميديت acting اللي هو لنتي أو نسميه MPH, takes 1 hour to be acting, والبيك ليفل مالته 4 to 8 hours, with duration 10 to 14 hours. And we have long acting اللي هو اثنين. عندنا ultra lenti وعندنا الجلارجين. الالترا lenti ياخذ 1 hour to be acting, and the peak level 10 to 14, والduration 18 to 24. والجلارجين اللي هو أيضا long acting takes 1.5 hour onset, and the peak level is none, and duration 30 hours. Now we speak about the insulin, regular insulin. It is a fast-acting or rapid-acting insulin, only type which can be given IV as well as subcutaneous. أيضا ممكن نضيف subcutaneous. Where 6 molecules linked with a zinc molecule to form hexamer. For abrupt onset hyperglycemia or ketoacidosis, ننطي regular insulin. Single IV injection 1 to 5 units. Continuous infusion 0.5 to 2 units per hour. وهي اكو انسولين بامب شايفين مثل ما نشوف بالصورة dose instructions. هاي اكو controlled release insulin ينطونه. Now we have a very rapid acting or called lispro insulin أو insulin aspart أو نسميه glulysin. عندنا ultra short acting و more rapid than regular insulin and shorter duration و less associated hypoglycemia but recurrent hyperglycemia يعني ما تصير recurrent before next meal due to shorter duration of action. Given just 15 minutes prior to meal. قبل الميل 15 minutes ننطيه هذا ال very rapid acting راح يسوي provides postprandial plasma insulin concentration يشبه النورمال like normal insulin. فعندنا الالترا short acting is very important. Intermediate acting or called lenti insulin, the absorption delays due to conjugation with protamine. And long acting or ultra lenti أو نسميه glargine given as single bedtime injection, lesser nocturnal hypoglycemia. هنا إذا رينا نقارن نشوف relative plasma insulin level بالhours فنقارن بين الجلولايسين انسولين واللي هو الاسبارت انسولين الاسبرو انسولين وهذا بين الريجولر انسولين هذا احسن واحد هو الجلولايسين وعندنا الانترميديت انسولين والاكستندد زنك انسولين والجلارجين انسولين. هاي بالنسبة للhours. Adverse effects of insulins they cause hypoglycemia, allergic reactions ممكن تجي عندنا lipodystrophy وعندنا insulin resistance هاي كلش common وhypokalemia وweight gain. Here we have insulin combinations. There are various premixed combinations of human insulin. يعني يخلطون نوعين من الانسولين مثلا إذا ناخذ 70% MPH و 30% regular insulin هاي أول combination. combination الثانية 50% of each يعني من MPH ومن regular insulin أيضا هاي تكون موجودة this combination. ليش يستخدمون ال premixed combinations؟ حتى شنو هاي بالنسبة لل premixed combinations used to decrease the number of daily injections but makes it more difficult to adjust individual component of insulin regime. إذن حتى نقلل ال daily injections. Now we have a standard treatment and intensive treatment. What we mean by standard insulin? Standard insulin therapy involves twice daily injection. Like an intensive treatment utilizes 3 or more injections daily with a frequent monitoring of blood glucose level. And the American Diabetes Association recommends a target mean of blood glucose level 154 milligram per deciliter والHbA1c اللي هو glycated hemoglobin المفروض يكون أقل or equal to 70%. The intensive treatment is more likely to achieve this goal. يعني إذا نعطي 3 or more injections راح نقدر نوصله للمستوى المطلوب. Intensive treatment increases the frequency of hypoglycemia, coma and seizure. شافوا إنه الانتنسيف تريتمنت تزيد الهايبوغلايسيميا والكوما والسيجر وأيضا بس بنفس الوقت شافوا إنه الانتنسيف تريتمنت تقلل reduction in microvascular complications اللي يصير بالدايابيتس مثل الريتينوباثي، نفروباثي، نيوروباثي هاي كلها تقل compared to the standard care. بس شنو ينصحون خبراء يعني الامريكان دايابيتس اسوشيشن تنصح انه الانتنسيف ثيرابي should not be recommended for patients اللي هم long standing diabetes واللي عندهم significant microvascular complications والناس اللي عندهم advanced age كبار السن يعني and those with hypoglycemic unawareness. In this slide we can see that intensive therapy results in threefold decrease, causes a threefold increase in the frequency of hypoglycemia, threefold increase, more than 3 مرات أكثر من الستاندرد ثيرابي تسبب increase in the hypoglycemia frequency. لكن clinician شافوا إنه هذا increase in the hypoglycemia combined by decrease in the incidence of long-term complications مثل ما قلنا retinopathy, neuropathy, nephropathy راح تقل with the intensive therapy أحسن من standard therapy. Here we are, now we finished speaking about insulin. Now we have a synthetic amylin analog. Amylin is a hormone that is co-secreted with insulin from beta cells following food intake. شنو الأكشن مال الأميلين؟ Amylin delays gastric emptying time, decreases postprandial glucagon secretion, and improves satiety حتى يخلي الإنسان يشعر بالشبع. فعندنا pramlintide اللي هو synthetic amylin analog صنعوه يشبه الأميلين. That is indicated as an adjunct to mealtime insulin therapy in patients with type 1 and type 2 diabetes. ينطوهم إياه يعني يساعد الإنسولين in the mealtime. ينطونه administered by subcutaneous injection immediately prior to meal قبل الأكل رأسا مباشرة. When pramlintide is initiated, dose of mealtime insulin لازم نقللها, decrease to 50% to avoid the risk of severe hypoglycemia. The other adverse effects مالت pramlintide هي nausea, anorexia and vomiting. And it should not be mixed with insulin, the same syringe. مفروض ما ينخلط سوا ويا الانسولين, كل واحد ينضرب بالسرنجة الثانية, يعني تختلف. And it should be avoided in patients with diabetic gastroparesis, الناس اللي عندهم delayed stomach emptying time, أو عندهم cortisol hypersensitivity, أو عندهم hypoglycemic unawareness. هذول المفروض ما نعطيهم pramlintide, contraindicated in these patients. Now we speak about drugs called INCRETIN mimetics. Oral glucose result in higher secretion of insulin than equal load of IV glucose. يعني إذا انطينا oral glucose وانطينا IV glucose بنفس الوقت راح نشوف الأورال جلوكوز يسبب secretion of insulin أكثر مما ال IV glucose. شنو السبب؟ السبب هو incretin effect. This effect reduced in type 2 diabetes mellitus. هذا الانكريتين يقل بالتايب 2 diabetes. فاحنا لازم شو نسوي؟ نزيد الانكريتين effect حتى شنو نسبب release of insulin. بالتايب 2 diabetes ينطون عندنا انكريتين هرمونز اللي هي مثل عندنا glucagon like peptide 1 اللي هو GLP-1, وعندنا glucose dependent insulinotropic polypeptide. هذول in response to meal. هاي الانكريتين هرمونز responsible for 60% or 70% postprandial insulin secretion. يعني زيد الانسولين secretion by 60 to 70%. فإذا كلش مهم الانكريتين. We have drugs that act as incretin mimetics like extenide and liraglutide. They are injectable incretin mimetics used for type 2 diabetes. يستخدموا بالtype 2 مثل ما قلنا, وexert their activity by acting as GLP-1 receptor agonist. يشتغلون على ال GLP-1 receptor. فشنو راح تسوي؟ شنو الإفكت مال incretin mimetics؟ They improve glucose-dependent insulin secretion, so improving the insulin secretion, and slow gastric emptying time. وreduce food intake by enhancing satiety تخلي الإنسان يشعر بالشبع decrease postprandial glucagon secretion تقلل الجلوكاجون and promotes beta cell proliferation تساعد على يعني إنه البيتا cells يصير لها proliferation النمو مال البيتا cell reduces weight gain and postprandial hyperglycemia وأيضا ال HbA1c level راح يقل. بس شنو الادفيرس افكت مال هذول الدراجز؟ مثل ما قلنا نوزيا فومتينج diarrhea and constipation هاي كمان. بس اكو اشياء مثلا الاكستينايد واللايجلوتايد associated with pancreatitis should be discontinued. إذا صار pancreatitis راح يسوي له discontinue. وأيضا شافوا بالدراسات إنه اللايجلوتايد causes thyroid C-cell tumors in rodents. بالrodents شافوا إنه يسوي C-cell tumors. Thank you.